I am very excited to be here with Danny Diosi today. We got chatting because we both work with pregnant women, with expectant parents, and I think we are very aligned actually in our thinking, but we do come from different angles. So I wonder whether, Danny, if you want to go first in introducing yourself. And
yes, sure. So I'm Danny Diosi. I am a hypnotherapist, hypnobirthing practitioner and hypnobirthing trainer, doula, antenatal educator. My particular interest is training other practitioners to be hypnobirthing practitioners. Because I have a huge interest in the subconscious and how that can help people prepare for birth. Hello, Kate.
And my name's Tessa. I think you're muted, Kate. We're going to take questions at the end if anything comes up. So so I teach pregnancy yoga. I've been teaching pregnancy yoga for, more than 17 years now. And then once I had my own children, I started teaching mother and baby yoga, and my focus is really community, is how can I grow community within my own local area, but also as time's gone on, sort of out into the wider world as well. And I started running State of Birth last year, symposium, to bring lots of different people together, whether they're yoga teachers, doulas, midwives, body workers, and anybody who does anything to do with the perinatal population. Together, like-minded people, to see how we can support expectant parents even more. But another side of what I do is cycle awareness, menstrual cycle awareness, not bicycles.
Just to clarify.
And that's brought in a whole new side of it around the rites of passage, because I really do think that how we go into puberty can affect how we approach pregnancy and birth, and then that goes on to affect how we approach menopause. And we can do all of those things consciously or not. And we're going to talk a lot today about the subconscious. So perhaps I can hand over to you, Danny, just to talk a little bit, if somebody's never come across hypnobirthing before, how is it that helps with the subconscious?
So hypnobirthing is really all about the subconscious, as is birth, because, when we're born, our subconscious is pretty much a blank canvas, apart from instincts. So to look for food, to cry if we're hungry, and physiological functions, breathing, eating, digesting food, going to the toilet, etc. We're born with those, and giving birth, as all the other sort of processes of the female cycle, are there when we are born. Everything else is added in as we grow up, and that's specifically important in those first 7 years. That's the kind of imprinting stage in the subconscious. So a lot of our beliefs, a lot of our values, a lot of our behaviors, etc., are kind of embedded at that very young age. And it might not be anything that somebody has specifically sat you down and taught you about. It might be information that, obviously as a child, you've absorbed by being brought up in a certain society, a certain culture, religious beliefs, how you were taught at school, etc., etc. And those messages get embedded. Your subconscious's ultimate aim is to keep you safe. So all the information that your subconscious has collated over the years is your main frame of reference. So in other words, even as maybe a teenager talking to other teenagers about menstruation or birth or anything to do with that side of things, other people may say things which kind of make sense or you find interesting, but ultimately what is in your subconscious is always going to come to the forefront, because it is the purpose of the subconscious to save you. In other words, it's always going to win. So hypnobirthing, when it comes to birth, it's not about pain-free birth. It's not about, not feeling the contractions. It's not about not talking about pain or anything along those lines. It's changing those beliefs, self-beliefs, behaviors that have been embedded and compounded as we grow up. So when we were talking the other day, Tessa, I was saying about how hypnobirthing is basically putting you back in touch with the birthing knowledge you were born with, sifting away all the added stuff that's been put in as we grow up. So it really is about sort of, creating new memories, new beliefs, new behaviors as far as birth is concerned. So very subconscious based.
Yeah, because you might have somebody otherwise that says, well, if we're talking about natural birth, then why do I need to learn all these things? Or why would breastfeeding be so difficult sometimes? And I think that's what we got really interested when we were talking to each other was, well, actually, we're not in this natural state. There's so much that society puts on us that, we're mostly, I think, unaware of all this conditioning that's happening until maybe you read a book or you see a video or you go on a hypnobirthing course, something like that makes you go, oh gosh, actually, I didn't realize that I'd taken all of that on. I love what you were saying about, that feeling safe. And apparently, particularly for women, we have this tendency to, more of a tendency than men, to fawn. So we often hear about the freeze, the fight, the flight.
Yes.
But a tendency that women can have is because we want to fit in, and particularly in that really vulnerable moment of being in labour, and you're not only thinking about yourself, but your baby, you don't want to put your baby's life at risk. And so it might be that a way of keeping safe is trying to fit in. And that's, that might be that you don't want to ruffle the feathers of the consultant who's really trying to put you down this particular route of intervention, but you're like, in the moment with everything that's going on, you're like, oh yeah, okay, I don't want to be the difficult one, that they're going to go.
And that's the thing, we're conditioned to respect authority. You're taught from a very young age that obviously people in superior positions, we need to listen to them, your parents, your teachers, the police, etc. So and that's something again that we would have experience all the time of when you go to the doctor's surgery, when you go and see a nurse. It's very much how we are taught to behave. And this concept you said about our need to fit in, that's very subconscious, because as humans, as mammals, we work better in herds. We stick to what we know because it feels safer. Going out on a limb is dangerous because you could get attacked by a predator. So it's all our behaviors are very instinctive. And if we have been taught not to argue, not to question, and also as a woman, don't question, because in the sort of the medical profession, and I'm just stating here categorically, I am not slating the medical profession, because there are absolute heroes there. But history shows us that a woman and her body and her, the way it works has always been seen as a slightly defunct male. Even to the point that, I don't know if you saw on the news in the last couple of weeks, in 2022, they have only just started using anatomically correct female models to teach female anatomy. And this is really representative of the whole of birth history, that it's birth and the way that a woman gives birth has been based on what doctors understand about men. And I've completely forgotten the point that I was saying, because I got very much on my.
I was going to say
conditioning. There we go. Yeah.
Because I used to work in a rheumatology department doing research, and again, when we look at the development of drugs for all sorts of conditions, they tend to use the participants in the studies tend to be male, because they don't have those pesky changing hormones that mess everything up. You know, it's just all the way through our society. There's a book that my neighbours promised to lend me called Invisible Women, which talks about how this is just embedded through society. So I haven't read it yet, but it sounds amazing, and it does talk about medical research and all sorts of other things like that. There's also Stacey Sims, who wrote the book Raw, and you know, she talks about training when you have a cycle, and how, you know, actually we're not little men, we're different, and we need to train differently.
Absolutely. And so I was talking to a group of friends of mine, because I'm of, shall we say, a certain age when I'm kind of experiencing the other end of the cycle and all the kind of perimenopausal hormones. And you know, I was getting together with my girlfriends, and we're all kind of the same stage, and we were all talking about, oh my gosh, are you noticing this and you experiencing this? And we were saying how, because it's not a male issue, it's not, you know, it's not being dealt with. And really, you only maybe become aware of it when you're actually going through it. You know, there's so much information that I'm finding and reading now, but it's not something that I would have even considered thinking about when I was younger. It got us onto a discussion about how everything is done through a male point of view, even, and I found this fascinating, town planning. Because, and I'm totally aware that this is generalization, so, you know, please forgive me if this doesn't apply. But when a man plans, he is going from A to B, the end. With a woman who is actually, ironically, probably doing a lot of the journeying, there's other factors to take in. So the woman, if she's a mother, has to take her children to one place and then sort of possibly come back on herself to maybe go to work and then go somewhere else first to take, you know, and it's completely all over the place and made more complicated because it wasn't addressed from the point of view of the people who are actually, you know, potentially using it, if it makes sense. Men view things very differently from women. And, you know, going back to that whole point about conditioning, this is how we're brought up, and this affects every stage of our lives.
Well, I thought we'd just go to puberty and sort of men up for a moment, to the first period, because I was thinking, you know, how conditioned we are around period products. And I don't know about you, but I went to a girls' school, and even in a girls' school, we're all girls, but you would still hide your tampon or your pad in your hand so that nobody would see it on the way to the toilet.
Yeah.
You know, and you know, so I've got some, you know, I wonder how many people actually keep their stuff out in the bathroom. So, you know, do you have your moon cup on show? Do you have pads out and about, or are they hidden somewhere away in a cupboard because you've just got this message, subconsciously or otherwise, that's just something you don't show, that's shameful, it's dirty, and it's probably never actually been talked to directly, you know, from mum or dad to child, but they've never seen those things out in the bathroom. And so you've got this message, you know, that's a place we don't go to. It's something, a dirty function of the body or something like that needs to, we'll just pretend it doesn't happen.
Absolutely. And I remember having a conversation with my husband when my girls started. I've got 3 daughters, started their periods, and you know, he's an absolutely great dad. He loves his girls, they adore him. But I do remember having this conversation that, you know, if they start talking to you about the fact that they've got their period or they're feeling crampy because they've got their period, he wouldn't, but I just felt like I needed to say this. Don't act embarrassed. Don't act kind of, oh, you know what, girls, don't talk to me about it. Go and talk to your mother, because you don't want them to think that it's something that they have to be ashamed of or keep from you. You know, if they've got their period, I want them to be able to kind of discuss it with you just as much as they can discuss it with me. I think it's very important. I think it's very important.
Because I think, you know, when I remember back to sort of sex ed at school, and it was very much fear-based, and it was all about, you know, don't get pregnant, don't get STDs. and that shutting down of the body. And then when sometimes I work with people who are maybe struggling on their fertility journey, it's almost like you're sort of trying to undo all that conditioning that happened at school in your teenage years, where you're like so scared of what your body could do.
Absolutely.
And then you've got to switch that round completely to being ready to,
and this is where this concept of sort of, I guess, hypnobirthing and feeling no pain comes into it. And again, this is something that we were discussing. It's reframing that concept of pain and understanding that you're feeling it because it's a muscle working. And the sort of, if we exercise and we work our muscles, and marathon runners and athletes, obviously they work their muscles to great levels. They're going to feel it. We do feel it when we exercise our muscles, but we don't walk around being panicked about that. We accept it, that it's our body working. When it comes to birth, because we have been told it's going to be agony, that is very much the kind of viewpoint that we approach it in. I remember quite early on in my career, I was queuing up in a soft play area for to get my kids some food, and there was a grandmother, a mother, and a little girl standing behind me, and the little girl was hopping about and complaining because she hurt her finger. And to this day, I remember very clearly the mother saying to her, "Stop complaining. If you think that hurts, you wait until you have a baby." And she was a little girl. She must have been maybe 5. But you can imagine that this is kind of the message that was being given throughout the whole time. Teachers teaching. I remember my daughters coming home from school and telling me that their biology teacher was explaining that labor pain is more painful for a woman than it is for a man to be kicked in the nether regions. And they were, "That's not right, is it, mummy?" Because obviously they kind of listened to me. But it's that complete lack of understanding that you're looking at two completely different things. You're talking about pathological on the one hand, being kicked, in the balls, and physiological, which is muscles working. And the way that we are taught about certain subjects, the language that we use, which is also really specific, creates different understandings and different beliefs. And whether it's periods, whether it's birth, whether it's perimenopause, whether it's any of the other cycles that women are going to be experiencing, we have had these years and years and years of conditioning. And the thing is, when we're young, we have unique experiences. We've never come across a dog until we've come across a dog. We've never cut our finger until we've cut our finger. We've never been given a chocolate button until we've been given a chocolate button. So those early years are really impactful because everything is new and unique and, a learning experience. As we get older, we are less likely to come across completely unique experiences. And when we do, our subconscious just kind of files it away in the most relevant compartment or dismisses it completely. So then every sort of experience with pain, shall we say, gets filed away under pain. And if you've been told that birth is this agonizing pain, then it's part of the same category. So sometimes it's about sort of, like you say, unpicking, unteaching, relearning, reframing, to help the subconscious speak the same language as the conscious brain, because the subconscious, as I said, is the one that's always going to come to the forefront, especially in times of heightened emotions.
Yeah, because we were sort of finding that we were aligned and that we do talk about pain in our classes and courses, because pain is a messenger. So it might be that in early labour, that somebody's experiencing pain and it's a continuous pain. And actually, if they know about this, they can think, oh, it's to do with the positioning of the baby, perhaps. And there's all sorts of things that they could do, trying a different position, movements, rebozo, lots of different things to help that baby change position, become aligned, be much more comfortable. And then they'll notice, oh, now I can feel the contractions that are coming and going. And I was also thinking about the pain, you know, that you have with periods, and particularly when a girl first starts, it might be all over the place. It might be quite irregular for some years, but pain is still then a messenger that's, you know, it might be that the cycle is settling down, or it might be that actually straight away something is wrong with the cycle. And that we need to pay attention. In that sense, we're really lucky. I think that reframing you talked about, we can reframe, aren't we lucky as women that we have this very clear barometer of our physical health?
Absolutely.
That men don't have. And actually, I was talking to a friend who's a homeopath and reflexologist, and she was saying that she's got somebody under her care who she's just started her period, and it's that first period has been going on for 3 months now without a break. And she thinks there's some link to a head injury, because the pituitary being in the brain, and that's sort of linked to the reproductive hormones. And it's only that now she's going through puberty that is showing up. So that's a real red flag. Something is wrong here.
Yeah.
He could just medicate it or put her on the pill and hide it.
Exactly.
But it's still going to be there. And I would love, if it was possible, to do some research where we looked at, you know, how our relationship is to pain through early experiences with illness or with, you know, painful periods. If somebody medicates that, are they more likely to go for pain relief quickly, wanting to go straight to an epidural or whatever it is? And there's no judgment about those things.
No.
I'm interested around, like, what are people's decision-making processes? I am pretty sure that there would be a link there.
Well, it's very interesting you say that, because I mean, we do live in a society where everything is fix it quick. You know, why suffer if you don't have to? Take something for the pain. And obviously birth is very much kind of lumped into the same category of, if it's pain, it's wrong, don't have to suffer it. And often when I teach hypnobirthing, when I teach pregnant clients, I give them all a questionnaire before I actually get to see them, just to sort of find out, you know, what they're particularly anxious about, which number pregnancy is this, have they had babies before? You know, people often tell me a lot about their fertility history. It's just always good to know, so that I can tweak my language and sort of, you know, make sure if I need to pay particular attention to a client when we're discussing particular elements. But lots of people say, I'm really worried about the pain because I have a very low pain threshold. You know, when I have my periods, I'm like, I can't move, I'm curled up, I'm in absolute agony. I've heard that contractions are worse than period pains. I'm not going to be able to cope. And I also think, I mean, you know, a lot of this information I've only sort of gathered really in the last few years. It wasn't something that I had the benefit of when I was going through my early teenage years and periods, etc. Is, you know, there's different stages in the cycle, and the period is very much about, and obviously you know more about this than me, Tessa, so do sort of correct me, but is more about, you know, when you kind of need to nurture yourself and you need to hibernate, and you need to kind of, you know, if you want warmth, then just kind of looking after yourself and being looked after. But we're very much taught, no, we get on with it, you know, don't be a wimp, don't be a wuss, stiff upper lip, this is what being a woman is about. And that message obviously carries through. We treat birth as though it is something that is wrong, in the sense that it's causing us pain, and all of the practices around birth, even pregnancy, we go to see that there is nothing wrong. You're told about what you can't do. Don't eat this, don't do that. sleep in this way, not in that way. We won't allow you to go past certain stages. Your baby's too big, you're too small, you're too old, you're too fat. Everything is geared up for things that are going wrong. So when someone has what they would term as a good birth, it's always seen somehow as, well, you were just lucky. You know, if my doctor hadn't been there, or, you know, I hadn't had this treatment, or I hadn't had that treatment, then, you know, something terrible would have happened. And, you know, unfortunately, and again, this is something we discussed, and, you know, obviously, if anybody watching this or listening has experienced similar, then obviously, you know, it's important that you look after yourself, because when people experience traumatic birth, or birth where they felt completely out of control, they feel that a lot of the decisions have been taken away from them. But we also live in a culture where people are almost, what's the word? Not criticized, but it's kind of seen as a sort of, well, you know, we're negatively wired, I think, is maybe what I'm trying to say. And, you know, sometimes when people have good births, that's kind of, well, that's not a true reflection of what birth is really like.
We saw that with the series that's been on with the Yorkshire midwives on call,
Yeah.
And some of the reviews that, for example, in the Guardian, I saw somebody had written that they thought it was very fluffy, and it wasn't factual enough to be a documentary. And I thought, well, birth isn't always very dramatic. It sometimes just potters along, and it happens in the water as the person wanted. And actually, how wonderful to see that this is a possibility.
Actually, the other side, because of how it's presented on television generally.
Yeah, to give more of a balance, because on the other hand, we have "This is going to hurt," which I know both of us don't like, and I wrote a complaint to the BBC about it, because I mean, I think it does have a normal trigger warning, but you know, if they have to put it out, I think it should have a much bigger trigger warning, because often the people I've talked to, when they watched it, at first they might have been laughing out loud, and it's again that conditioning, you know, some of it was quite slapstick, and like, oh, look, the initial reaction is, oh, how absurd, or something like that. But when you actually, their subconscious was actually processing all of this, and then some of them said, for a few days I felt really anxious, I felt like something was off, and I couldn't pinpoint what it was. And sometimes only when I sort of was bringing it to their attention that, well, actually a lot of what you see in that objectification of women, some of the language that was used was just horrific, in my opinion.
I couldn't actually, well, I watched the first episode to think, you know, am I getting on my high horse? Let's just kind of, and even this conditioning, let's just put on my big girl pants, let's kind of, you know, not be so sensitive about it. You know, the book sold however millions of copies.
It was the #1 bestseller.
Yeah. So let's just watch this. And it was yeah, I can't even put into words, which, let me tell you, is not a usual occurrence.
I sat there and I could just feel my nervous system.
Yes.
Like,
yeah.
How horrible. It's, yeah. And but on the other hand, it's so interesting, because I've got friends who are midwives or other kind of health professionals, and they found it very validating.
Yes.
So they were saying, you know, I've been in that situation where I'm thrown in the deep end, or I didn't have quite the right equipment that I could have done with, or, you know, really being pushed mentally. And
I think that, you know, it very much does highlight that, you know, it is not a great place to work. And, you know, we know, especially at the moment, sort of post-COVID and everything that happened with that certainly maternity units, they're very understaffed. You know, they have long shifts where they don't even get to kind of go on a wee break or eat.
Yeah, or take their water bottles in.
Exactly. And that, you know, that is not acceptable working conditions. And I understand that, but I think what I'm so passionate about is actually informing parents and couples that because the system is the way that the system is, because it is it's an autonomous position. If some profession, if something goes wrong, it's that individual that's to blame. There are expectations, and there are it's safer from the practitioner's point of view to follow those protocols and those procedures, but that doesn't mean that you have to follow them. And actually, if an intervention is being suggested and you have asked questions to help you establish whether that intervention is because of policy or because it actually affects you as an individual, then that helps you to kind of understand maybe why your birth has gone from being in the water to needing continuous monitoring and perhaps a cesarean at the end, rather than kind of just not understanding how you got from A to B without so much as are you okay with this?
I think it goes back to that conditioning that you talked about before, where I think this is changing, but there was very much this sort of paternalistic feeling in the NHS where you go and the doctor is the expert and you hand over your agency to that person.
Be a good girl. The amount of people that are told, which is hideously triggering for some, don't argue. This is what I am telling you as a medical professional. Do this or else. And what is very interesting is when I teach my regular antenatal classes, as opposed to my hypnobirthing classes, I always talk about, have you heard of the BRAINS, an acronym? Yeah, so benefits, risks, alternative instincts, nothing, etc. And when I'm talking to people, the class, you can see they're very uncomfortable with this concept of questioning. Why would you question the people who know what they're doing? Why would you question the people with the medical degrees?
I always say brains with an S at the end, say,
yes,
the S is for smile, because it might sound like this is going to be you're questioning, but you're doing it to find out information. It's not
absolutely it's not and it's absolutely not to carte blanche refuse all medical intervention, but it's asking for information which you're entitled to. And when we have reunions, they always say, without fail, they are so glad that they were taught how to ask the questions, and they all use it. But the concept of questioning someone is such an embedded, no, you don't do that.
And this is so important, like we said, that, through all the rites of passage, because in the scenario I gave earlier with this girl who's had continuous bleeding since her first ever period, over the years, I've heard of so many young teenagers put onto the pill very early just because it's easier to control skin or heavy periods, really bad cramping, maybe they're fainting at secondary school. And rather than sort of thinking, well, maybe that's a quick fix because we need her to get to school, but actually we want to look at the underlying reasons of why this is happening, that just stay on it, because there's not been the questioning to that GP or whoever to say, well, but what are the long-term side effects of this? Is this actually getting to the cause of what's happening, etc., etc.? And then we see this through to menopause, where recently we've had a lot in the media about menopause, and there are some people, for example, there's a lady, Louise Newman, who talks about menopause being a deficiency, and actually all women should be on HRT to top you up and have the right level of hormones. And always there's comments underneath her thread saying, but I can't have it because maybe they've had a estrogen dominant cancer or something like that, or whatever medical reason, they cannot have HRT. So you're just dumping me on the waste pile now that I can't get that. And we know that one size doesn't fit all. That's never been the case. Whether it's diet or exercise, we're really, really different. And so if you, going to the GP in terms of menopause, and they're, well, at the moment, it's not an easy fix because there isn't enough HRT. We've got a shortage, but you need that questioning again. you know, what's right for me? Can I have that hormonal test to
Yeah.
know exactly what's happening with my hormones before I go down one route or another?
It's even the fact that you're very lucky to come across a GP who actually understands perimenopause and menopause. You know, in the same way that you're lucky to come across a GP who understands about breastfeeding, or, you know, or even, you know, postnatally, you know, 6-week checks are done over the phone. How can they check you? It's quite hard to get the relevant information. You know, it does seem to be that it is luck of the draw that you happen to speak to the right person at the right time, who has access to the right information, or who is able to kind of give you alternative options if you aren't able to, or, you know, choose not to go on something like HRT, or, you know, go down medical route pregnancy wise. Or, I mean, it's like this ever sort of spiraling effect.
So maybe we can just take a pause for a moment, because that's a lot. It feels like a raw deal that we're getting. So for those that are watching or listening, just taking a moment, maybe if you feel like closing your eyes, taking a breath. Oh, how is that landing? I can really feel like my solar plexus at the moment is going, ah!
Yeah.
And maybe if you're sitting, leaning against something, you can just lean back into that support. If your head's supported, let your head be supported. And just let that land. It's a lot. And it can feel quite unfair sometimes. It can feel, you know, why have we got this to deal with? But actually, maybe we can then switch it around and think about reframing, and what can we then do when we're carrying this conditioning. So taking some big breaths. If you're watching this as a recording, you can always pause, go and get a drink, have a stretch, and we'll think about some positives that we can some action that we can take. Because I was thinking, you know, when you're ready, you can open your eyes again. Yeah, the first thing is awareness, isn't it? It's bringing these things into awareness. It's the first step.
Absolutely. And understanding that, you know, even if you don't feel like you want to or are able to kind of take on everything head on, the whole picture, it's understanding little things that you can do. You know, the little things that can make the difference. So even, you know, whatever stage of the female cycle you're at, focusing on your breath, you know, that release of breath, that exhalation is what tells your body to switch from sort of sympathetic nervous system to your parasympathetic nervous system. And we don't spend enough time in our relaxation cycle, which obviously that rest and digest, that parasympathetic nervous system is what we need to be in for all our internal systems to work more efficiently and more productively. And regardless of your, you know, your state of health, or, as I said, where you are, or what you might be experiencing, just being able to take that time out every so often, like we just did then, to just focus on the breath. And you always have the ability to do that.
Yeah, because, you know, I'm always saying to people, put it, you know, you're pacing yourself. So whether it's with your cycle, and rather than just thinking about, oh, the period's here and, oh gosh, it's horrible, and what am I going to do now to sort it? We're actually trying to think all the way through the month of putting things into place, resting, you know, maybe listening to relaxation, trying to think about cleaning up your diet a little bit, and just little steps, not all at once so it's too overwhelming. But the same with, you know, in labour, if interventions are being suggested, I always say to people, just ask for a moment.
Absolutely.
You know, in most situations, you can have 5 minutes with your partner to go, oh, well, that came out of the blue and I wasn't really wanting this, but how do we feel about it? Let's have a hug. let's talk it through. Maybe it is the right intervention, but just having that chance to let it land in your system.
Exactly.
And then you can go ahead, and that feels so much better than, oh gosh,
yes,
this is being done to me.
Exactly. Just take that moment, because I always say, if it is not an emergency, as in, you know, you're not being sort of rushed off then and there, you have time to talk about it. And actually, you know, if God forbid you find yourself in the situation where you are rushed off, then that's very much when the NHS comes into their own. And thank God we've got that kind of life-saving technology. But if they're not doing that, you have got time to talk. And it's not about, as I say, refusing medical intervention. It's about giving yourself, as you say, Tessa, that moment, those 5 minutes, just to kind of readjust, refocus, recalibrate, and then move on. And that's something that we can, you know, we can take through every sort of walk of life, isn't it? Just kind of giving ourselves that moment to just, okay, let me just sit with this for 5 minutes before I react. And, you know, I'm sure if my husband was listening to this, he would be laughing his head off. Like, what are you saying? But yes, I know I need to practice more what I preach, but it's very much that sort of just take a minute.
And that all of these things take time, because, you know, the arc of puberty can be over 10 years, that a body is changing, that we're settling into, you know, rhythmical periods. Same with menopause. The whole process often takes about 10 years. The official menopause, just, you know, once you've not had a period for a year, but actually the arc of getting there is much longer. And same with, you know, labor, not going to last 10 years, but but it takes time. And often I think in our culture, where we use, like you were saying before about the quick fix, it's like, we want to time manage this, you know, we want things to happen at a certain rate. And we just know that this is not the way that labor unfolds, because of the psychology of it as well. And I remember just before the pandemic, there was a lady who, it was her third baby, and through the labor, she didn't have a contraction closer than 20 minutes apart. And that's not what they say in the textbook. No. That's not what it says in her NHS notes is going to happen. And it was the last 3 contractions, where she was pushing, came very close together, baby was born. But if she'd gone by the standard advice that you're given, you know, they would have said, oh, it's not happening quickly enough, you know, not in established labor.
Absolutely, because in all, you know, everybody is lumped into a box marked one size fits all. And like you say, this time, because obviously on television, when we see a birth, it happens really quickly, doesn't it? And people don't appreciate and understand that early latent stage of labor is so important for the body to start its preparation. There's a brilliant book called Childbirth, Reclaiming Childbirth as a Rite of Passage by Rachel Reed. Have you read that?
Yeah, she's our keynote speaker for the State of...
Oh my God, a little bit of a fangirling thing going on here, because she's amazing. And the way that she writes about the kind of the emotional changes, and the fact that labor takes a long time, because not only is it the process of giving birth to a baby, it's the process of giving birth to a mother. And when we hear about these really rapid births, whilst, you know, the rest of the world might be thinking, oh my gosh, I wish, wow, you had such a quick birth, how cool is that? Mine was 24 hours, 48 hours. Actually, those quick births can be really, really overwhelming, frightening, because it's not giving the body a chance to kind of go through the hormonal changes, the hormonal waves, the drawing you deeper into your subconscious and your instinctive brain. That is part of the necessary transition of becoming a mother. And it doesn't matter whether this is your first baby, third baby, fifth baby. We need to do that with every baby that we have to you know, just kind of allow us the process of it.
And I think it's the same also with the menopause. If somebody has a medical menopause, maybe they've had chemotherapy for breast cancer, or they've had to have their
hysterectomy or
uterus
something,
and
yeah.
ovaries removed, and you're suddenly bam into that menopause. That's such a shock for the body. And what I hear from a lot of women is that that's much harder to cope with than the sort of gradual, where your hormones are gently adjusting, just like
Yeah.
if you have a natural labor, the birth hormones are gradually increasing rather than that synthetic oxytocin that you're off 100 miles an hour and it feels too overwhelming, because the body naturally kind of, you know, wants to let us in gently to this.
Yes, exactly. Exactly.
I think there are so many parallels, and I really believe that if more people had this menstrual cycle awareness and felt like they understood what was happening with their body, their own unique patterns with the cycle, you know, that would really help me as a pregnancy yoga teacher and help them on their journey through pregnancy.
Absolutely.
Birth, because
exactly, even length of their cycle has an impact on the length of their pregnancy. You know, we're told that everyone is pregnant for 40 weeks. Once you get to that 40-week date, you're overdue. Well, actually, if someone has a long cycle, that's not the case.
yeah, I've had people in pregnancy yoga who, you know, in their family they have 43-week gestation.
Exactly. Were you allowed to go that long? How can they let you go that long? Weren't you worried about how dangerous it is? And that conditioning starts from the minute we are born.
And I know, is it Sophie Fletcher who wrote Mindful Hypnobirthing, and then she's more recently done a menopause, mindful menopause. So I think we're going to see more and more of this actually coming through to that rite of passage, where actually people are recognizing that we can bring awareness, we can have a conscious menopause. And I've got friends who've taken a menopause sabbatical, which sounds amazing. You know, they planned for it and they put money aside. So they, yeah.
But you can only do that if you know it's going to happen. I mean, obviously we know it's going to happen, but I don't think we appreciate the emotional, mental, physical toll that takes.
Although, you know, in my case, my mum had sort of an early menopause because of breast cancer, and before my grandmothers died, I didn't think to ask them about their menopause. They never spoke about it with my mother or my father.
Yeah.
I have no precedent for what it should look like for me and my family.
Exactly.
I feel like I'm going into the unknown.
Yeah.
I'm trying to plan as much as I can and think, you know, I won't be able to continue in the same way, because I'm an ideas person and I put all these things into place, and I know I'm going to have to create space and create pause as I go through that transition. I'm very conscious of that. I started weight training last year, so I keep my muscle mass.
Absolutely.
I'm putting things into place already.
And reframe it into, and this is something that I have to keep reminding myself of very much, that it's not the end of something, it's the start of the next chapter of my life. And you know, again, we kind of have been very much sort of brought up with the concept that once you're past your fertile stage, or you know, once you're sort of you're old, you're not a young woman anymore, then you're past your best, you're on the shelf. And what it leads to is kind of women trying so hard to be you know, younger with everything that we do to ourselves. And actually, a friend of mine put it very succinctly. She said, you know, she's not 20 years old anymore. She doesn't want to be 20 years old anymore. And actually, what's the point of trying to look 20 when you're not? Leave that to our daughters, and let's kind of raise them with positivity about each and every stage of their you know, of their cycle, so that it's actually seen as a positive thing and not as something that's like, well, you know, might as well be consigned to the rubbish dump now.
Yeah. And so one thing I'd recommend to people is find your tribe. It's just like when, you know, you're a mum and you're trying to deal with your baby in a particular way. Maybe you're really into slings and you don't want to leave the baby to cry. And I always say to people, find people who are like you, because then you get that moral support. And I think it's the same going into menopause, is that, you know, find examples of people that are consciously going through this journey or deciding to age naturally. I've recently come across a lady called on Instagram, she's Train with Joan, and she's this amazing, I think she's 70 something, and she's really into weightlifting, and she's just such an inspiration. She's so much fun, and she's glamorous, and she's enjoying, you can tell she's really enjoying her.
I want to be like that. I'm going to look her up and follow her on Instagram.
Yeah, and I think actually we're so lucky because we have lots of those examples now. Kate Codrington is a friend of mine, and she's just published Second Spring. Yeah, and you know, she's one of the people that's taken a sabbatical, and that's such an inspiration. And I follow people like that because I'm then, you know, conditioning myself to think this can be a positive thing. This can be a really important transition where I get to go into another stage of my life where actually the oxytocin's not making me so motherly, and I actually more focused on my truth and getting, you know, my stuff done in the world. How amazing is that? I hear, you know, a lot of people who are postmenopausal saying actually it's really refreshing to have that constant energy and to know where I'm going to be tomorrow, in a week. So there are positives that we can take, you know, and I think that's important to surround ourselves. Same with teenagers, we, you know, maybe have to bribe them into things sometimes, but, you know, like there's Rites for girls, where, you know, I think I'm right, is it 10 to 12-year-olds that they focus on, but that they a year's journey where they meet up with other girls outside of their school group, where they talk about all these sorts of issues of peer pressure and consent, and they can really you know, go into it deeply and have this wonderful like-minded tribe around them that they can lean into when they have all these things to grapple with.
I think, and especially in today's age when everything's on social media, you know, they all live their life on social media, and it is all about, you know, what we were saying about we kind of need to find our tribe, but social media kind of almost thinks that actually if you're not in this tribe, which is this sort of, you know, hugely popular number of followers, look a certain way, believe a certain way, act a certain way, then there's something not right with you. And it's very, very hard to be an individual in the face of, you know, like the sort of the mass. And I think, you know, the getting this message across about actually find the people who let you be you, rather than constantly trying to seek something that isn't you, but you feel that it should be. Because we need that community. We absolutely need that community. As you said, at whatever stage of life you're at, you need like-minded souls around you so that you feel constantly and upheld, and that your beliefs are, if they suit you, then that's fine, rather than them being wrong or weird or odd or controversial, or, you know, let's reframe them to be positive, rather than always kind of going to that negative focus, which is again something we're conditioned to do.
I'm going to do a plug for my podcast, which is called Cyclical Creativity and Transformation, and it came about because I thought, you know, there's so many teenagers that feel so much pressure at school, and, you know, it can feel like it's make or break. You know, if you mess up your GCSEs or you mess up your A levels, then that's it. But we know that it's not like that. And so I interview lots of amazing women who do fascinating jobs, and like, how did they get there? And it's often a very meandering path.
Absolutely.
And there've been light bulb moments where they go, wow, you know, and they've changed direction. You know, and my hope was that people would listen to it maybe on a car journey somewhere. They tend to be like half an hour, and just to have this sense of, I don't have to decide who I am now. I don't have to fit in with the crowd. I can do something really different. Interestingly, a couple of them started out in fashion, and then they've ended up kind of meandering to this very different place. You know, we are allowed to change over time, and
it's often not until we kind of maybe experience those kind of transitional periods of our cycles. I mean, my focus when I was younger was to always be in drama and theatre. I did a drama degree, and, you know, that's what I was going to do. And it wasn't actually until I had my children, I became a mother myself, that I actually thought, no, I don't want to do that. I want to do this, which is nothing I wouldn't have thought about let's be a hypnobirthing practitioner, let's be a doula. When I was at school, it was only once I had my children and kind of experienced my older two are twins. So, you know, that was kind of a journey in itself. But it's only once we experience those transitional times that we actually often find are what it is that we want to do, our sense of self and worth, maybe, which again is why these points in a woman's life should be treated with celebration and with, you know, the coming into our awesome power, which is what it is, rather than feeling that it has to be sort of downtrodden or hidden, or we give in to what it is that we want because it's much more kind of the acceptable.
And I'm just thinking, Danny, maybe what we can do where the video is going to be posted is share some of our favourite books around different transitions that we've come across, so that people have a starting point. If this is all kind of new idea, that there's some place they can go to start building their awareness.
Yeah, no, I think that sounds like a great idea.
Yeah, brilliant. Well, I know we could talk about this for ages, but I feel like now my solar plexus has calmed down, and I think I'm feeling a wave of oxytocin. I feel like, oh yeah, we're making connections, and that ripples out into the world.
Definitely.
So I think we'll stop the recording, and then if there are any questions, we can answer those. But just before we do that, where can people find you, Danny?
So my website is Mama Serene. So that's www.mama, as in mother, serene, as in calm.co.uk. And my website is all about training practitioners to be hypnobirthing practitioners, and, you know, basically kind of bring that knowledge and awareness to as many pregnant people as possible, because we need to spread that word.
Brilliant. Yeah, and people can find me at tessayoga.co.uk, and there's things there about the yoga, training, cycle awareness. It all sort of goes out from that point. So thank you so much for joining me, Danny. It was absolute pleasure
Having me.
Join you.